Hi, my name is Martin Kirk. Today I'm going to be talking about public health protection, community water supplies and other water sources. This is part of the MEDI8115 Fundamentals of Health Protection and Health Promotion course running from the Research School of Population Health for Semester 2, 2016. Today we're talking about protecting health, and I've deliberately put up a picture of the Melbourne water supply districts for the eastern part of Melbourne from the 1900s. And you can see there are some major pipelines listed there, Maroondah and O'Shanassy. And they're from the main catchments, which are to the northeast of Melbourne in the green, red and yellow. These water supply catchments were deliberately set apart and restricted from access from livestock and humans, and they have provided an excellent water source for the last 150 years for Melbourne. There was a lot of forethought from the founding fathers of the city to protect these areas and deliberately restrict access. The water comes into reservoirs from rainfall into these natural forests, and it's a very high quality, so low colour, low turbidity, and it's easily disinfected, and then it's sent. It used to be sent down through open channels down these pipelines, but these days it's through closed pipelines. And for many years the water quality was so good that there was no need for any further treatment apart from addition of fluoride or chlorine. These days the city has had to supplement its water supplies given the expanse of the population, and particularly down towards the southeast of Melbourne. So they've had to include other water supply systems that have even extended to desalination. But still these protected water quality catchments here have served public health in Melbourne very well. So today we're going to be talking about a framework for health protection. I really want to extend what we talked about last week so we can think about the framework that we can apply for health protection. We're going to be discussing safe water, and I'm particularly going to focus on drinking water quality today, but we will talk about some of the others. And I really want to use this as a model for health protection so that it can help our understanding of the systems that have been built up and the frameworks that have been applied to protect public health. Next week we'll be talking about food safety and the system that is applied there, and it's quite different despite some of the hazards being similar. That's largely because of the way the food supply is constructed and delivered compared to water supplies, where it's far more easier to control and homogeneous. We'll be talking a little bit about exposures and hazards, and I'll give an example of a water supply contamination event. We'll also talk about assessing and monitoring risk, and then we'll summarise at the end. So a framework for health protection. Here down the bottom we have our population that we're keen to ensure lives as long and healthy as possible. As we discussed last week, there are 10 essential public health services, and here are some that I believe are relevant for health protection. So public health services develops plans. They prepare and train for events and also to secure health protection. The Public Health Services develops policy and regulations to ensure protection. And then finally, it investigates events, enforces public health law, and conducts audits. As we discussed last week, there has been a gradual change in the services that public health provide over time, so that many of the services are now provided by government, other government agencies, or even non-government entities. So a good example is where wastewater might have been once monitored by wastewater quality might have been once monitored by the health department, but is now monitored by the Environmental Protection Agency, and it serves a dual function there in that they're monitoring it for environmental quality indicators as well as public health quality indicators. Similarly, we can have non-government agencies involved, so that they may even be industry that has a role in protecting public health. So we can have water cooling tower companies providing quasi-public health services, ensuring that cooling towers are maintained effectively and preventing the population from disease. All of these together assess risks and develop strategies to manage them and communicate it to both the public and also to other stakeholders. Hopefully they will identify all the threats, and this risk analysis framework, as we discussed last week, which is a combination of assessment, management and communication of risk, will intervene and protect the public from these threats. But occasionally things do go wrong, and we'll have a look at an example of that today. So why is water important, and why are we going to spend a whole session talking about it? Water is important because it's essential for life. This is the Googong Dam in Canberra, and you can see that it's looking pretty low there. We take it for granted that we can just turn on a tap, have a shower, flush a toilet, and fresh quality drinking water is available for us to just drink without any further treatment. That's not always guaranteed around the world, but it's a core part of society, and it enables societies to develop with relative ease. And it's a very strong indicator of socio-economic wealth, but most importantly, it improves the population's health dramatically. And we can see from many systematic reviews that improved treatment in water has dramatically improved the health of populations. So when we think about health protection water, it's vital for health. It maintains it helps us maintain ecosystems, including food production environments, used for drinking, used for recreation, and it can both deliver contaminants to the population, and we can also use treated water to protect human health from contamination. There's a role in developing standards to protect human health, and we also see the benefits of water sanitation and hygiene, and often termed WASH, which prevents many different types of diseases. We'll go through some of those shortly. And here is a table showing transmission routes for different types of water-related diseases. So, for instance, with waterborne diseases, the main way that those diseases are transmitted is through people ingesting the pathogen, and they're usually fecal oral transmission. So examples of that is diarrhea or typhoid fever. For water washed, this is where we've got person-to-person transmission due to lack of water. So we might have skin and eye infections such as scabies and trachoma, which is a common problem in water poor areas. So even in rural and remote parts of Australia where there's high incidence of scabies and trachoma. Then we've got water-based illnesses or diseases, so transmitted via an intermediate aquatic host. So that these are water-based infections. So good examples are schistosomiasis or guinea worm, where people become infected by contact with the intermediate aquatic host. Water inhaled, where there's transmission by inhalation of aerosols such as respiratory infections due to Legionella bacteria causing Legionnaire's disease or mycobacteria causing pulmonary infections. And then finally, water-related insect vectors, where we might get transmission via an insect breeding in or biting near water. And good examples of these are dengue, malaria, trypanosomiasis. So these different water-related diseases just show the breadth of different types of diseases that can be transmitted by water, and these are really largely infectious. We haven't even considered some of the types of chemical related ones or radiological agents that are also waterborne or water based, where someone's come in contact, or water washed, I mean. So if you think about water, there's a range of different ways that people become exposed to potentially hazardous agents. So drinking water is a very potent one because of the fact that we ingest it, and that means that agents can be taken up into the body or they can establish an infection within. We have washing, which obviously is critically important for water wash diseases. There are industrial uses, so we might find that it's used in industrial settings and that it presents an occupational risk or a risk in a particular setting, such as a hospital. We have cooking. Obviously, water is used routinely in cooking, and if there's contamination with chemicals, we might find that that's concentrated in cooking and causing problems for the health of people. Recreation, obviously, recreational waters pose a problem because we often have high concentrations of people in recreational waters, and they can be lesser quality, so they're often not drinking water quality, but and still acceptable for recreation from an aesthetic perspective, but they may actually expose people to pathogens or other chemicals that can cause illness. And then finally, wastewater, which, as we've already heard, is a potential problem when it mixes with water or people come in contact with it through infections. So wastewater is a very potent cause of infections and diseases, and there's a need to separate people from wastewater and also drinking water supplies from wastewater. So if you think about the health protection cycle for water, and we talked about the health protection cycle last week, so obviously when we're thinking about any particular water source, we identify the potential water contaminants that can be transmitted via that water source. A risk assessment is conducted, and then there's some health-based standard setting, usually on a hazard-by-hazard basis. And then there's some consultation with consumers, experts in water industry about how to deal with these contaminants. Water authorities will commonly prepare water safety plans, and we'll talk a bit more about them later, which is a means of identifying the key vulnerabilities of a water supply or a water source to pathogens and contamination. This is then turned into a decision about appropriate treatment. Water treatment occurs, and hopefully surveillance and monitoring of the supply verifies that their water is actually fit for purpose, and then that feeds back into identification of potential water contaminants through surveillance. So many of the standards that are used for public health protection are based on health. So there are really a couple of different health-based standards. So the first is health outcomes, where and these are based on disease that we want to prevent. So the concentration of an agent in water or a hazard in water that is equivalent to upper disease limits. So we normally say that we want to present 10 to the minus 6 DALYs per person per year, which when we think about it is extremely small, given that one disability adjusted life year is 1 year of healthy life year lost. Or it could be the concentration equivalent to an upper disease limit for a no observed adverse effect level for chemicals. Each hazard is considered separately, so that makes it complicated if there are many different considerations for a water source. We also have water quality targets, so guideline values for some chemicals, and performance targets where there are groups of hazards. So we might say for some things where we can't actually identify the health outcomes, we might have performance targets for a treatment stage in the water cycle where we might want a certain number of log reduction of pathogens. So Campylobacter, for instance, we might want to reduce it by a 2 or 3 log reduction if it's present in the source water. And then specific technology targets for certain types of technologies used to treat the water. Just to go through what disability adjusted life is, and some people may have heard of this before. disability adjusted life year is 1 year of healthy life lost, and it comprises of years lived with a disability and years and the sum of that with years of life lost. So if we use a graph to illustrate that, if the average life expectancy is 80 years, with 0 being years lived at full health and 1 being death. So if someone were to contract a disease at age 10 that had a disability weight of 0.25, which is reasonably severe, so it's quite disabling, and they lived with that for 40 years, so that would be 40 times 0.25, so the number of years by the duration by the disability weight, and that would give you 10 years lived with a disability. And then if at age 50 they died, they would have lost 30 years, so they would have gone down to a disability weight of 1. They would have had 30 years of life lost. So in this instance, the DALYs would equal 40 DALYs. So when we're saying we want to prevent 10 to the minus 6 DALYs per person per year, the health authorities have constructed a risk model designed to protect people at very low concentrations. So really there should be negligible disease due to the levels of contaminant in the supply. And normally that's a theoretical risk. Here's examples of the different types of health outcome targets and for different agents. And so for something like for fluoride, which is a chemical added to water supplies to protect against dental caries, we might have a no observed adverse effect level, which is derived through risk assessments, and the water quality target that it has to be less than 1.5 milligrams per litre. For Campylobacter, we might have a tolerable disease burden, which is 10 to the minus 6 DALYs per person per year, which is derived from a national policy decision about how much we want to protect. So they measure or assume concentration of 100 organisms per litre in source water, and they would apply a quantitative microbial risk assessment, and from that they would develop a performance target for Campylobacter, which is a minimum performance for 6 log removal. So that would be based on the different types of treatment elements in the water supply system. So it might be filtration gives you a 1 log reduction, and disinfection gives you a 5 log reduction if it's maintained at 1 part per million of chlorine. So that's the process of setting health outcome targets. And then finally, example 3, which is an example of cryptosporidium, where you would use tolerable disease burden of 10 to the minus 6 DALYs per person per year. You would probably be unlikely to have source water information on concentration of cryptosporidium, so you would specify a technology target, which would be coagulation and filtration for surface waters, knowing that they're effective if they're working well against cryptosporidium. So if we go on to drinking water, and you can see here on the left a pipe in the distribution system, it may shock people to think that the distribution system actually has living organisms in it and sediment, and the pipes can look like this. They develop a biofilm on them, which is a mixture of different organisms, and really they are a little ecosystem. So it's sediment, it's organisms, it's a range of different biological matter, and sometimes that can actually be released into the water supply system, particularly where there's disturbances such as breaks in the main water supply, or there's been repairs and people will get dirty or turbid water through, and often containing bacteria, which is the reason why it's important to maintain a disinfectant residual throughout the water reticulation system. This just shows a chart of improved water supplies in 2015 from the World Health Organization's information system, and you can see that dark blue is that 100% of suppliers have improved water, meaning that they're treated in 2015 for dark blue countries, and the lighter it gets, where it's completely clear means there's no information, but lighter blue and through to the yellow and brown colours means there's much lower. And you can note that Papua New Guinea is in the category of having less than 60% of its water supply being improved. So very low levels of improvement for some countries, and particularly in Africa, which implies that they've got less health protection for their population and a greater risk of waterborne diseases. So if we think about the different types of contaminants and criteria for safe drinking water, obviously all of these types of things come to mind. So we've got microbiological contaminants, chemical contaminants, we've got disinfection, which is to counter microbiological contamination but can also result in byproducts itself and pose a risk to public health. We have radiological contaminants, which might be a problem, so gases like radon and other radiological contaminants that might be injurious to health. And then finally, acceptability. While it's not really a public health concern, acceptability is what gets the consumers' attention. They are going to always be ringing up the water authority about tastes and odours more quickly than anything else. All of these are dealt with through water safety plans that the World Health Organization they changed their risk development mechanisms for water supply guidance in the 1990s, from one where it was all about end product testing through to developing a risk-based approach. And so water safety plans is the way that they do that, and that's really monitoring the actual points at which the risk occurs. So water safety plans are really intended for water authorities to go through and develop water safety plans for all of the reticulated supplies they manage, and it should set out the governance overseeing the water supply and describe the system in detail. Each system should be described down to how many water sources feed into it, where the reservoirs are, the pipes, the different reticulation zones, the whole system in great detail. There should be a list of the potential hazards and threats and their potential likelihood. These obviously need to be covered in detail as well. And then control measures and priorities for treatment. Based on that assessment of hazards and threats, the water authority should be able to identify what are the specific control measures. Then that should allow them to set limits based on national and international guidance, and in Australia the National Health and Medical Research Council has developed its own guidance on water quality contaminants, and it's very similar to those established by the World Health Organization, although it's more context specific for Australia. Most water authorities and health departments and other government agencies regulating water tend to use the National Health and Medical Research Council guidance, and they apply these limits and specification on how monitoring should occur. Because if you think about it, it is actually quite difficult to think how do we test a reticulation system to ensure that there's no contamination and that some of the quantities of chemicals that we've added to disinfect the water supply have actually been effective. In a large city it can be quite complicated, and so the larger the city, the more samples there'll need to be to verify and validate the treatment program. And then finally, management procedures need to be outlined in these water safety plans for when things aren't quite right. And they don't necessarily mean there's an outbreak of disease, but it might be something that the water supply, raw water quality changes. So if there's large rains in the catchment, it might affect the turbidity of the water coming into the treatment plant and overwhelm the treatment plant, leading to dirty water going through to consumers and potentially unsafe water and getting lots of complaints. So this water safety plan is very much a risk-based approach as opposed to just testing the end product and making sure that whatever you have done has worked. There's still a testing component through assessment of limits and monitoring, but it is far more based on the actual risk and trying to look as far upstream as possible. It's probably worth saying something about fluoridation, which is one of the chemicals that are added, and there are several added to water supplies, but fluoridation is twofold. Firstly, it is for preventing dental caries, so it's usually added to water supplies at a concentration between 0.6 to 1.1 milligrams per litre. At higher concentrations, however, it can actually be deleterious to health, so we can have dental fluorosis, which is mottling of the teeth, and even skeletal fluorosis at higher temperatures, and at very high temperatures you can have acute poisoning. It's very rare in water supplies where the water authority has actually dosed the water with fluoride, but it can occur on rare occasions. Usually with fluoride there is a regulatory approach to ensuring that there's protection of the consumers, but it also enables water authorities to add fluoride to the water. Clearly there's a lot of community concern about it, and particularly with its links to cancer and other effects on bones. However, many systematic reviews over the years have confirmed the safety of fluoride and how effective it is at preventing dental caries. It's important to note that some water supplies, particularly those that come from a groundwater source, are naturally high in fluoride. So when I say groundwater, I'm really meaning water that's been drawn up from an underground water source. They can be very shallow, from 100 feet right down to hundreds of metres deep, and come up hot and have to be cooled before they can sent into a reticulation system. But some of those that have been in contact with the soil may have leached fluoride into the water and be naturally high enough to protect people's dental against dental caries. Plumbing is obviously a critical part of safety of the water supply, but it is definitely an area that has been moved into routine assessment of the water system and development of houses. So when we're talking about protecting health, we're talking about the pipes and the connections. There are aesthetic and safety issues, so we can occasionally have situations where corrosion products in the pipes can lead to discoloration, tastes and odours. We also occasionally see instances of copper and other chemicals being leached into the water, particularly where the water is very acidic, and that can cause health problems. So one example is where schools have been sitting vacant over the summer holidays, and all the students come back in after their holidays and the water's been sitting in the pipes. Many of them might have had copper piping, and so when they turn on the tap to have a drink, they'll get water with high concentrations of copper, which is an emetic and causing vomiting to occur, and that can be really distressing. It's probably not necessarily a long-term health issue, but it's certainly something that is concerning for the pupils and the staff. It's a different story with some other chemicals, and lead is a good example, which is one of the reasons why lead-based solders in plumbing have ceased to be used in drinking water supplies. There are also connection issues which can pose a problem for public health, both backflow, where there's a potential for suction to occur in a reticulation and suck back water through a drain, and that can mean that water really intended for sewage ends up back in the reticulation system and potentially causing illness to consumers at some other point in that reticulation system when they turn on the water from their house. We can also get cross-connection where people might inadvertently connect a sewage pipe to a drinking water supply, and it can contaminate the water coming out and cause human illness. Obviously, the key ways of preventing this is through plumbing standards and also building inspections. And it's a very effective system that really doesn't interact very much with public health, but it's important to recognise that once these functions were carried out from within health and through engineering staff working in public health departments. So when we're thinking about disinfection, which as I've mentioned is one of the key means of protecting public health, we are talking about killing pathogenic microorganisms. There's a substantial health benefit from disinfection, and systematic reviews of the efficacy of treatment of water, which includes both filtration and disinfection, range markedly, but anywhere between 30 to 80% of diseases may be averted by disinfection. There are a number of chemicals that can be used for disinfection, including chlorine, bromine, iodine, and various forms of these chemicals, along with ozone, which are highly effective at treating killing microorganisms. These chemicals are oxidants, and they also have the dual benefit of bleaching organic matter as well, and so they can actually improve the quality of water markedly. There are also non-chemical forms of disinfection, including ultraviolet light. The thing about ultraviolet light is it doesn't provide any disinfection residual in the supply, and the water needs to be very clear for it to work. It's important to note that even with disinfection, though, they do result in organic byproducts which can be a concern for consumers. In particular, trihalomethanes have been a concern for causing cancer, and these result when organic matter is oxidized by chlorine and they form trihalomethanes, particularly in environments where there's a lot of organic carbon in the water supply. That said, the direct link to disease is still relatively equivocal due to the fact that it's difficult to conduct good epidemiological studies at low concentrations of these agents. So as we discussed last week, there are various different types of sources of contamination. You can see some of them here, and this is really for community level supplies. You can see here we've got contamination that can arise from rural homes, which might be small septic tanks, it might be stormwater. There are other non-point sources from cities, and people may not realise how contaminated the stormwater supplies are in big cities like Melbourne. When there are heavy rains, the water flushes out the stormwater system, which ends up in Port Phillip Bay, where you can actually detect plumes of very high concentrations of fecal indicators into the bay after rains, which is why they advise not swimming in those city beaches after rain because of the stormwater. So lots of contamination arising from there. We can have cropland putting in pesticides and fertiliser, animal feedlot putting in high levels of organic matter and fertiliser and animal fecal material. Suburban development, similarly to rural homes and cities. Sewage treatment plant can discharge sewage into a water source, and that's probably fine provided it's treated, and treated well, but if not, it does pose a potential risk to health. And then finally, factories are common sources of contamination, particularly for non-microbial causes such as chemicals. I showed a picture of Gugong earlier on, and here is the treatment flow process. So the first step here, you can see they've got selective abstraction from the water source. What that means is that you saw there was a big tower at the beginning, and that's really a tower with an ability to take in water from different levels. So if the water quality is better at a certain level, they can take it at lower down or higher up, depending on where the best quality water is at the time. And it does vary quite a bit across deep water reservoirs, just because of the stratification of water due to temperature and other properties. They have the potential to add powdered activated carbon, which probably isn't done all the time because it will be relatively expensive, but it would be useful for removal of tastes and odours or any other dissolved organic matter. Then you see coagulation, flocculation, which is where they add chemicals to cause the finely divided solids to clump together into floc, which is clarified in where water goes down through a blanket. And then there's dissolved airflow. They could also use dissolved air flotation, where they put bubbles through it and all of the floc clump, it gets caught by the bubbles and taken up to the top where it's skimmed off, and the clean water goes down into the filter. So the sand, usually sand filtration, will filter finer particles out of the water, where it's then disinfected with chlorination to kill microorganisms, followed by pH adjustment to ensure that the chlorine is effective and lasts when it reaches the distribution system. They then add fluoride, and it's then sent to service reservoirs, probably usually covered reservoirs around Canberra, and you'll see them on hills. They will be pumped up to those service reservoirs so that they can then drain by gravity down into the lower parts of the city through transport pipelines and ultimately to customers. So that's a very simple way of thinking about it, and if it wasn't a public holiday day today, I would be definitely trying to see if we could do a field visit to a water treatment plant, because they're really quite impressive how much water they treat each day, and they're a critical part of ensuring that the public's health is protected. So as I mentioned before, authorities have switched over from an end product testing to using indicators of system performance, so water quality indicators. They're not usually health related per se, so a good example is Escherichia coli, which is a bacteria which is common in the guts of warm-blooded mammals, including humans. So they're an indicator of the microbiological quality of water, and more importantly, an indicator of the effectiveness of disinfection. Disinfectants are usually measured directly in the reticulation system or just post the treatment plant, but E. coli is also measured in the distribution system, and so if you had effective disinfection, you expect to not find E. coli. It's relatively common to find small concentrations on occasions, but you wouldn't want to see it very commonly in a water supply where there's there's coagulation and flocculation, and then there's filtration, and then finally disinfection. You'd expect the water quality to be very high. One thing to note though, many people have criticised E. coli as a water quality indicator because its presence is not always correlated with pathogens. So sometimes you'll have E. coli present but no pathogens, and vice versa. You might have no E. coli but presence of pathogens. However, I think overall as an indicator of potential fecal contamination, it is excellent and tried and tested. There are other water quality indicators of a microbial nature, and there are many others that are chemical, and also process related, so the pH of the water to see if it's acid or alkaline, which can affect the effectiveness of disinfection. You also have turbidity and a range of other things, and these are monitored throughout the water treatment process, but also in the reticulation system, so they can identify problems as they're occurring. And then finally, aesthetic water quality indicators. Obviously, things like turbidity and colour don't always have a health impact, but they are of an aesthetic nature, and they can certainly influence the supply. And as I mentioned, they're the first thing that people ring up about. Is not whether the water's unsafe, it is just purely about whether it tastes or looks unusual. So water quality surveillance is vital to ensuring safety, and as I mentioned, chlorine residuals form a very big part of that, making sure that there is chlorine present or some other form of disinfection within the supply. As I've already said, water authorities have moved away from end product testing, so testing the water supply all the time, everywhere, to more of a system of process control where they are really testing the water supply on occasions at critical points where they know that there's potential to have a feedback loop to a treatment intervention. So, and water quality surveillance is different from validation or verification that the water treatments occurred. So it's really looking at results in the reticulation system. It's often conducted by the health authority or along with the system owner, and in many states of Australia you'll find that the water authority takes the water samples, but the results are sent on to the system owner and also the health authority, and that's just to give an independent view of the water quality. Mostly for drinking water, the surveillance is established in regulations along with the water supply plans, water safety plans that I mentioned before. And they'll specify things like the monitoring sites, how frequently, the particular testing targets. And it's true to say most water authorities go well over what's required of them in terms of testing. No water authority wants to be supplying contaminated water to their consumers because it has disastrous consequences. And here's just an example of Yarra Valley monitoring zones, and this is from the Melbourne Water. The Yarra Valley, there are 3 companies in Yarra Valley that supply water to Melbourne Water, another company. They're government-owned companies. And you can see here, these are all in the northeastern part of Melbourne, from Doncaster out to Healesville. It's the similar zones that I showed you on that first map with the different catchments, and you can see there are still some of those reservoirs there that were present on that first map, such as Maroondah Reservoir and Sugarloaf. And so they are being supplied by protected catchments, as I mentioned. And you can see the numbers next to the names there indicating how many samples were taken in the month of June. And here we can see summary results for June 2016 from one of those postcodes. And you can see they've measured 3 things here. One is THM, which is trihalomethanes, and there is the Safe Drinking Water 2015 standard, and it's and you can see that they've got a rolling annual result which is greater than 100% of samples have complied with that drinking water standard. They've also got one for E. coli, which is 98% of samples less than 1 colony forming units per 100 mils, which is extremely low. It's essentially equivalent to no E. coli present in the water supply. And then finally, turbidity, which is greater than or less than or equal to 5 turbidity units there, and 100% of samples have complied. And turbidity, while it's an aesthetic quality, so it's very fine particles in the water which make it turbid and difficult to see through. So it's equivalent to when you go swimming in the ocean and it's been raining and it's really cloudy. That's what you get in drinking water as well. But it also affects how well disinfection functions. So if you've got very turbid water, there's probably a lot of organic matter there, and the chlorine's taken up, reacting with that organic matter, and may not be available to disinfect and kill microorganisms. And you might also find that the that there's no residual in the reticulation system either. So if we think about recreational water, we can have both man-made recreational waters. So there's a spa pool there. That's me sampling a spa pool many years ago in a Legionnaires disease outbreak. And on the right we've got more natural sources of recreational water, and they both pose potential risks to health and are controlled by regulations. So obviously spa pool and swimming regulations are common, and they have been for over 100 years. Pool operators conduct regular monitoring of their swimming pool and spa pool, so they'll be testing chlorine residuals. There's not really any monitoring of microbial quality, despite that being the main target for the disinfection. The main reason being that swimming pool operators have to actually maintain 1 part per million of free chlorine or some other equivalent disinfection, which, if there is that much chlorine present, there shouldn't be any microorganisms of a bacterial nature surviving. And they have to record results, so testing is usually done every 3 to 4 hours, and it's recorded in a logbook. There are various hazards in recreational water settings, including pollution inputs, bather load, obviously, so more people, more contamination, more likelihood of disease-causing organisms being introduced into the pool, and also exposure. So people are more likely to be exposed in recreational waters. And last week we talked about primary meningoencephalitis, where people jump into natural water sources and water gets splashed up their nose and they become infected by amoebae. It's difficult to regulate natural water bodies, and it usually relies on public health advisories. And here you can see someone taking a sample at a natural water source with a sign in the front saying, "Health warning, this water may cause ill effects to humans and animals, no direct water contact activities." And that's probably relating back to something like cyanobacteria, which produce toxins, and they can cause skin irritation, but also they can cause more severe illnesses if people ingest water while doing recreational activities. There's also industrial uses, and here's a picture of two large cooling towers in an industrial park, and at the bottom of those cooling towers there will be water which is probably equivalent to a large swimming pool, and the water circulates up to the top and runs down through baffles, and air is drawn up through that so that it can actually exchange heat with the water, and the water becomes cooler and is then used to cool building in the air for a building, which is recycled through the building. But these cooling towers do produce aerosols, and for that reason they can actually cause infections like Legionnaires disease. When we think about wastewater, the key, as I mentioned last week, was to separate water and wastewater. We want to make sure that human and animal waste stays out of water that humans and animals have contact with. It can be anything from a large-scale wastewater treatment plant right through to a packaged treatment plant, right through to a small septic tank that serves a single household. All of them produce, they're designed to treat waste, and all of them can result in contamination. In terms of what they're trying to treat in a wastewater setting, it really comes back down to solids, organic matter and pathogens. So they'll have different treatment processes, and there are different types of treatment modes similar to water treatment plants to separate out solids and to deal with the organic matter and the pathogens before it's treated and then reused. There's obviously approval required. It's one of the key means of protecting health through plumbing, and also the Water Authority, and any reuse of wastewater is usually heavily licensed and there are conditions applied on it. And a good example is if you wanted to use wastewater for irrigating vegetables, you would have to ensure that you're using wastewater from a treatment plant that had been left dormant in a treatment pond for many months before it was actually reused. And so during that time, pathogens are likely to die off and less likely to be transmitted through the food supply if they're used on vegetables. And they might be only allowed to be used on certain types of vegetables. And here is a map showing global improved sanitation in 2015 from the World Health Organization. And again, you can see that Papua New Guinea has extremely low rates of improved sanitation, as does much of Africa, and China and Russia are getting better, up to North America, Europe and Australia being fairly similar. You'll notice New Zealand has no data. I'm sure they do have excellent sanitation, but I just point that out. So obviously the combination of sanitation and drinking water treatment, so this concept of improved water and improved sanitation, really are key to the country's scale of development and also their wealth, and it's linked into the health of the population living there as well, intimately linked. So when we think about regulation of water sources, they're usually health agencies or environmental protection agencies, and as I mentioned, they're taking a risk-based approach these days. It's not just on the actual level of contaminant in the water supply, it is very much how much disease can we avert. The focus is on ensuring public safety, so they tend to monitor critical control points in the reticulation system or the system of water delivery. And they're looking at integrity of supply. The regulations are really focused on making sure that the quality of water is the best it can be throughout the supply system, and that there are no breaks where contamination could be introduced. And it usually incorporates monitoring that feeds into surveillance for public health purposes. In terms of response to contamination, and thinking particularly about water sources where the public has contact, so recreational water supply sources or drinking water supplies, the public has a very low tolerance to contamination. It's more easily understood where it's a natural water source, like a lake or a river. But where there's illness that can be widespread through a drinking water supply, if you're supplying a whole town, contamination can actually be delivered very easily throughout the whole reticulation. Often the contamination is at source, so it's way back up in prior to treatment, and it will, at that point, it's a very effective vehicle, so you can contaminate a whole supply contaminated water to a whole town, and it has serious consequences in terms of illness and death. The interventions are well understood in contamination incidents, and that is pretty much boil water or avoid water to distribute emergency supplies, and that's commonly done. So just a case study, this is an outbreak that occurred in April 1993 in Milwaukee, Wisconsin, where chemists started to run out of Imodium. They fairly quickly noticed that one particular part of the city of Milwaukee, the southern part, had increased rates of diarrhea, and many people weren't coming to work. The water supply was identified as a cause. There had been very poor controls of the water treatment plant, and turbid water had been allowed to go through the plant. Cryptosporidium was detected, and at the time they knew cryptosporidium could be distributed by water, but really hadn't seen big outbreaks. In this instance, cryptosporidium is one of those pathogens. It's a protozoan parasite, so a single-celled organism that is not destroyed by disinfection at the normal level. So you need very high concentrations of chlorine to actually kill Cryptosporidium. So that the need was to deal with it in other ways. So they actually you need to boil water. And in this outbreak it was huge. It ended up being 403,000 people with 69 deaths and many flow-on effects for many years. Here's a picture of someone in Milwaukee boiling water for a restaurant, and just a nasty sign if you were needing Imodium. Obviously bioterror is another issue which is an extension of water contamination events, and it's important to protect water supplies from potential bioterrorism because they are accessible. As they're easy to deliver pathogens and chemicals to a whole community, they can actually also be used where people are trying to intentionally contaminate. Every time this happens, it is always a police matter, and the police do the threat assessment, but it's often not a great vehicle due to the dilution effects. So if you think about how many millions of litres of water are in reservoirs, it can be thousands of millions of litres in some of those. So trying to contaminate it with enough chemical to cause a health effect is quite difficult. And so they're not great vehicles for bioterror. That said, there's reasonably frequent threats to contaminate water supplies from people who have a reason to do so. So we talked earlier on about risk analysis being the overarching framework for risk assessment, risk management, risk communication, and how it's key to scientific and policy development along with public health action. And I think here you'll see that risk assessment, this process is definitely followed both for standard setting but also risk assessment in the context of water supplies. So it's very much a part of the water safety plan. This is the component that is drawn in, so assessing the hazards, the dose response, exposure assessment, and characterising the risk, and ultimately leads to measures to manage the risk. So in summary, health protection is vital for safe water supplies from infectious, chemical, radiological or biological causes. In particular, water supplies can result in major problems rapidly due to the widespread nature of exposure. And I showed you this picture last week, and this is the effects of water treatment in a recreational setting, and it's really spectacular how good it is. So I think what we will be doing this week is, recently in New Zealand there's been an outbreak in Havelock North. What I'd like you to do is to look at the regulatory regime for water supplies in New Zealand and find out what you can about the risk-based approach to preventing waterborne contaminants in New Zealand, and then also to identify what you can find in the media about the supply in Havelock North and think about some of the means in which it became contaminated. It's a particular type of supply. It's a bore water supply, so it will have its own particular reasons why it's become contaminated. Usually bore water supplies are very well protected, and there will be some things that you can probably identify from just searching the internet and looking in the literature about bore water supplies and protecting them. And just because they seem to be good all the time doesn't mean they are. So I'll be very interested in your feedback on the forum, and I'll be posing about 3 or 4 questions which you should be able to find information from on the internet and the literature, which should be really interesting. So I hope you've enjoyed this foray into protecting health from water contamination today. Here's a few extra readings for people who might be interested looking at drinking water, waterborne diseases and recreational water. And it includes some really incredible references with the World Health Organization and National Health and Medical Research Council, US EPA, CDC. I think in particular one document to have a look at if you're interested in drinking water is the World Health Organization Water and Sanitation and Health website, where they have extensive guidance on a range of different components of water, but particularly the drinking water guidelines from the World Health Organization have been produced for well over around about 50 to 80 years. I'm not exactly sure of the exact date, but they're extensive and they give fantastic guidance. They're almost universally used around the world to assist water supply authorities to deliver safe water to the population. So I will look forward to reading your responses in the forum, and I hope to speak to you soon. Thanks very much. Bye.